Ipasa sa kwan.
Proper grooming.
Dili mapasa ni ko.
Demonstrating your
Kung tag-as ka video, dili mapasa.
So for your shaving,
Allow to verbalize feelings and yes,
1, 2, 1, 2,
approval, respect,
3, 4, 5. So we have 5 procedures. Shaving.
Five?
Yes.
Allow to verbalize feelings.
5D?
Then, encourage to do as much consistent as possible. Ibo siya, then gusto niya
Okay na,
pagkakasya
sir.
niya. Sige, ako lang ani. Ayun, ikaw lang ka na. Ayun lang, ako lang ani mag deliver man. Ako
Okay, so before you shaving and shaving in your completed
wala
bath.
siya na question.
Shaving completed bath.
Yes. When you're shaving, you have to remember, before to mag-start ha, sorry. For your procedure, you have 3 parts. So first is your opening spill, your procedure proper, and then your closing spill. So for your shaving, you have to remember, you have to explain the procedure to your patient and then introduce yourself to the patient and gather all the materials that you will be needing. So what are the materials that we should be needing this time? So we have our basin, your 2 towels. This is for under the head of the patient and across the chest of the patient. Then your kidney basin. Yes, your kidney basin and then the shaver. Shaver, yes. Then your shaving cream. Then do not forget, always observe proper body mechanics. So what is the purpose of your proper body mechanics?
To prevent from strain of the caregiver.
That is the safety of the caregiver and also the safety of the patient. Yes. So, good morning, ma'am. So this is how your opening spells goes. So good morning, ma'am. I am Ben. Sir. Good morning, sir. I am Ben, your personal caregiver for today, and I will be shaving you. So before you start, gather all the materials. So since the materials has already been gathered and prepared, you have to adjust the bed in an appropriate working height, which is at the level of your greater trochanter. And then if the bed has wheels, you can lock the wheels. If the bed has no wheels, you can push the bed against the wall and then saddles on both sides and then lower the saddles of the part that you will be working. So each time you have to put something or if ever you're going to move your patient, so at least you have to remind or you have to tell your patient so that your patient would also be aware of what you're going to do next. So ma'am, sir, I will be placing towel under your head.
Una pa lang, dapat mapiyansa na ka.
So on the count of 3, I'll be raising your head, sir. 1, 2, 3. What is the purpose of your towel under the patient's head?
Parehaan ang mo answer ba?
Yes,
Pillow.
to prevent the pillow from getting soiled or getting
Now, why
wet.
did we describe
Then
that?
also
The baby is not comfortable?
Chest towel.
this is the towel and across the chest of your patient. Then you have to prepare also your basin. What's the basin for? What's this for?
For
For the
washing.
rinse the
Rinse.
washing and rinsing.
No, actually that is for washcloth soak in warm water. So first you have to soak the washcloth first in warm water. Then you have to apply that to the
Face of
to the face of the part that you will be for the patient that needs to be shaving.
Need to.
So what is the purpose of your warm water? Soap.
the pores.
Open yung pores.
Yes, that is number 1.
Yes, number 1.
To relax the tense skin. Second is to facilitate the opening of the pores. Then, ask your patient to at least, if ever your patient is conscious, you can ask the patient to close his mouth. So can you close your mouth, sir? Then at least place the washcloth soak in warm water or warm water in for about 5 minutes. And then after that, you can remove that one. Then now,
Put
you
the
can
shaving.
apply the shaving cream. So in applying your shaving cream, where will you start?
Distal.
Yes, from distal going to the proximal. So
Proximal.
remember that principle, Larissa, that is to save time and energy. So at least Sorry kayo ha, I forgot to mention you'll be using your gloves for this
Sabi na siya, sir.
procedure.
Wash, gloves.
Then you can also apply, since you'll be using your gloves at this dorsal part of your gloves. Then apply a liberal amount of shaving cream to the patient's cheek and mouth. Then you have to instruct your patient that to close his mouth to prevent the shaving cream from getting swallowed. So you have to start from distal. Sir, can you close your mouth?
Distal to.
Distal to close your mouth. So now, after applying your shaving cream, you have to get your shaver. You can
Razor.
also use, if there is an electric shaver, you can use that one too. And then, what are your considerations? What are your precautionary measures
Kanang kuan,
when shaving your client?
kanang
Make sure that
the hair, kung unsay iyahang kuan sa hair, sir mo, direction sa hair.
yes, you have to shave according to the
Hair
growth.
direction.
According to the hair growth. And
Hair
then,
growth.
that is the second. The first is you have to thaw the skin. Remember, your patient here is, let's say, an elderly. So your his face is more likely wrinkled. So you have to prevent injury. You have to thaw the skin. So imong binaton, binaton mo. You have to thaw the skin to prevent injury. And then you have to shave according to the hair growth. Wash. Then shave again.
Every stroke, sir.
Yes. Every gawa na siya kasay, di ba? Pag nagmamano na. One, then wash. Then pa shave.
Then pikas.
Tingnan
Other
support.
side.
Then wash.
Then pat and dry.
Then after shaving your patient, you have to wipe off excess shaving foam or shaving cream using your washcloth soak in warm water.
Or water.
Then you can also again instruct your patient to close his mouth. Sir, can you close your mouth? I will be wiping the excess shaving foam, shaving cream. Then after that, you have to use your washcloth again with soak with cold water. So what is the purpose? Why do you have
Close
to use the yes, that is to facilitate the closing of the pores. Okay. So after placing it, after maybe a minute or 2 or 5 minutes, you can remove that one. Then after removing, now you can pat dry. So what is the purpose of pat drying?
To retain the moisture of the skin.
To seal the moisture of the skin. So that is the purpose of your pat drying. Then after pat drying the patient's face or the mouth area, you can now remove the two towels. Sir, can we place your head removing the towel? Then after that, you have to remember you have to remove your that is your closing spill na dayon. So the procedure proper, those were during the shaving, applying the shaving cream to shaving, and then to applying the washcloth soak in warm cold water. And then for your closing procedure, you have to discard your glove, return the materials to proper location, ensure the safety of your patient by checking or monitor vital signs, and then adjust the bed to possible lowest possible position to prevent the patient from falling. And then saddles up both sides, and then lock the wheels if the bed has wheels, or if the bed has no wheels, or push it the bed against the wall. Record that you have done and report any unusual condition to the supervisor. So what are the possible unusual condition? Yes. Yes. Whenever you accidentally cut your patient's skin.
So
Okay, so that is your shaving. The next will be, we will proceed to complete bed bath. Yes. So for your complete bed bath, it will be...
Ano, sir?
Pwede.
Pwede ra mahulat ni sir.
Sige, lima. Lima ni siya ka procedure, di ba? So from... lahat, dili.
Lahi tong shampooing na, sir.
Lahat na siya po kang ma'am ay na siya nga assign nga pan. Si ma'am ay mo maglo niya na for me shaving and then complete bed bath. So for your complete bed bath, you will be it comprises from removing di ba? Removing soil.
Soil the linen.
Yes, removing the clothes or dress with an IV and then replacing with a clean gown. And then helping clean the dress, complete bed bath, back rub, and then mo to padre sa shaving. Lima siya. Okay. Sige sa mama. Mama ni siya. Okay. 1 2 3 4 giving back rub. Yes, giving back rub. Ano siya, giving back rub. Thank you. So again, first, for your opening spiel, you have to introduce yourself and tell the patient what you are going to do. Then gather the materials that you will be needing. Then adjust the adjust the bed to appropriate working height, which is in the level of your greater trochanter. Prevent yourself from getting strained. That is also for the safety of the caregiver and the patient. Then settlers down on the side that you will be working. So this time we will be using 3 basin. So basin, wash and rinsing basin, and also for soaking basin. So now we will be starting.
Cleansing
So if ever we're going to bath the patient, so what part of the body of the patient that you should be starting to wash? So the face. The face. So same is with the shaving, you have to place the towel under the patient's head. Ma'am, excuse me, I'll be placing towel under your head. And after 1, 2, 3. And then towel across the patient's chest. Then you get your 2 basins. So basin for washing and basin for rinsing. So you have to place a towel under the each basin to prevent the bed from getting wet or soil. Then now you can use your mitt. So what is the purpose of your mitt? So your mitt has 3 purposes. That is, number 1, it retains fluid, then induces warmth and comfort if applied, and then prevents spillage of water. Nanasin yung kana, sorry, tulad na siya. Retains fluid, induces warmth and comfort if applied, and then prevents spillage of water. So wash and rinse. And then you have to start first at the eyes. So upper inner canthus to outer canthus down to the
Earlobe.
and then upper inner canthus to upper canthus to outer canthus. Then you have, but remember, you have to again start at the distal. Always kinasiya. So from inner canthus to outer canthus, then back to the earlobe, then wash and rinse. Lower canthus, inner lower canthus to outer canthus, then wash and rinse. Repeat if necessary, and then change the water if necessary. Then to the other side, upper inner canthus to outer canthus, and then back to earlobe. This wash and rinse. Lower inner canthus to outer canthus, then going to the back of the earlobe. Then wash and rinse. Then bridge of the nose, going to the cheek, and then to the neck. Wash and rinse. Bridge of the nose, cheek, and then going to the neck. Wash and rinse. And then mandible. From the mandible going to the chin. Wash and rinse. Ano gana? Wash and rinse. And then forehead. That is your last. Forehead. So either you can use the principle from center as guide, that one, or you can also wash and rinse, what do you call this one stroke. Okay? Wash and rinse and then repeat if necessary. Then change the water if necessary. Then after washing the face, you can pat dry. That is to seal the moisture of the skin. Okay. Then remove the materials that you use. Proper location. On the count of 3, ma'am, I'll be removing the towel. Answer. 1, 2, 3. So this time, we'll be cleaning or washing the body of the patient. So before that, we have to undress the patient. So if ever your patient is, the part that is affected is right. Cut sa tagid. Okay. So if ever your patient has, let's say, the patient's affected part is on his right. So where should we start undressing the patient? Right or left? Unaffected or affected? So unaffected. We have to undress the patient unaffected first. So since the IV is on his right, so we have to abduct the near arm. So place the patient in a sideline position. Abduct the near arm and release the farthest leg. Then place the distal arm distal to the abdomen or near to the body, and then support the shoulder and the waist. Then on the count of 3, by observing proper body mechanics, place the patient in a sideline position. So shoulder and then the waist. Sir, on the count of 3, we'll be placing in a sideline position. 1, 2, 3. Then tie the strings of the gown of the patient at the waist strings. Okay, then upper. Then place the patient back to supine position. So whenever you make a move, you have to at least aware your patient. So at least she can anticipate. So on the count of 3, place your patient in a supine position. 1, 2, 3. Then we have to undress the unaffected first. Unaffected. Then to unaffected. Always remember, provide privacy at all times to the patient. Then you have to roll it like a ball. So what is the purpose? Why do you have to roll it like a ball?
To prevent
From spreading of the microorganism.
Yes, that is to contain the microorganisms. Then it must be folded, must be rolled away from your body. Then place it to the laundry basket. Laundry basket naman dito. So now we will be placing the bath blanket. So what is the purpose of your bath blanket?
To cover and give comfort to the patient.
So aside from that, what is the main purpose of your bath blanket? So your bath blanket, sir, yes. Aside from that, the main purpose of your bath blanket, this is to condition the mind of your patient that she or he is going to have a bath. Malas guna ninyo kung atong CR, ganahan mo maligo. Di mo ganahan maligo kung wala mo ikuan towel. Kaya naka-condition mo maligo ko, so magdala ko ani. So it is help to condition the patient that he or she is going to have a bath.
3 minutes lang.
7 minutes na lang, sir.
3 minutes lang.
Sige lang.
Blood area, sweat area,
Okay, kaya namin.
Then you have to roll the top sheet at least to the roll. You have to roll towards the ankle level.
Okay na.
You have to provide privacy at all times. Okay. Then this time you're going to get your receiving towel. So which part of the patient we should be washing first? Sa principle na to? So we have to wash always at the distal. Distal, then expose only the part that you will be cleaning. Okay? Then you have to use this time your soaking basin. So this time you will be using 3 basin. washing and rinsing basin, and soaking basin. So for your soaking basin, remember you have to put always a towel under the basin. That is to prevent the bed from getting wet. And soak the hands of the patient. Then your bristle brush. And now you can prepare the washing and rinsing basin. Then make a mitt out of your washcloth. So what is the purpose of your mitt? Sa laundry? It contains fluid, provides warmth and comfort if applied, or induces warmth and comfort if applied, and then it prevents spillage of water. So wash and rinse. Then you have, in the manner of cleaning your patient using your sponge bathing is, during sponge bathing is long firm stroke. Long firm stroke. Okay. Including the axilla. Wash and rinse. Okay. Wash and rinse, then repeat if necessary, and then change the water if necessary. Then this time, you're going to wash or brush the nails in between the fingers. So this what you call the interdigital spaces. Interdigital spaces. And then if ever your patient asks or let's say request for a deodorant, so you can either apply upon the request of the patient as always. Then after washing, you have to pat dry to seal the what? To seal the moisture of the skin. So by the way, when washing or when you start washing the body of the patient during sponge bathing, you have to remember some points. So you have to start first on the distal arm, chest, abdomen, proximal arm, distal leg, proximal leg, and then the back. Sige na, balik na ta. Distal arm,
Abdomen, and then
Chest, abdomen, and proximal arm.
distal leg, proximal leg, and then back. Okay. Para di mo mawala ba? Next sa iyong part. Then this time we will proceed to, since we're done with the distal arm.
Back rub.
Chest.
Chest pa? Pwede nga kuman, sir?
Wala pa, sa arm pa man to.
Galit.
Sige lang. Are we there yet? After placing your receiving towel, you have to pull out or at least remove or roll the back blanket. Oops, sige lang. You have to provide privacy at all times. Okay. Then for the sake of demonstration, I will be showing it to you. So muna at least, this is the part, this is how will you perform or the arrangement of your bath blanket to your receiving towel. Then you have to make a mitt out of your washcloth again. So, what is the purpose of your washcloth?
Dense fluid.
Yes, contains fluid. This is warm and comfort if applied, and then prevents spillage of water. So again, wash and rinse. You have this time you can also use the center as guide method. So that, wash and rinse, then repeat if necessary. Then this part again, this part. Then wash and rinse. You can use center as guide. Center as guide. Anahin mo pa, you have to start from the center and then always start at the distal. Wash and rinse, then distal part, then wash and rinse, repeat if necessary, and then the other side. Then wash and rinse. Now you will be washing the nipple of the patient if ever your patient is yes, women. Okay.
circular motion.
Yeah, in a circular motion. Wash and rinse. And then repeat if necessary, wash, change the water.
Pag inverted ang nipple, sir.
Yes, you can retract the nipple.
Retract the
Yeah,
nipple.
retract the nipple. Then wash and rinse. Then this time you'll be using the figure of 8. figure of 8. So you'll be washing from this side, from the distal side to proximal side. So you'll be doing this one. Ana. Okay, ana. Wash and rinse. Then you have to repeat that if necessary. Then remove that or replace the water if necessary. Then after that you have to pat dry. What is the purpose of pat dry?
To seal the moist.
Yes, to seal the moisture of the skin. Then pat dry. So now we will move on to the
Alam mo, okay, i-clarify din na.
then make a mint out of your washcloth. Then wash and rinse. Use Cinder's guide again. So starting from the distal, going to the proximal, wash and rinse. Then to your, you can also use or clean the, what do you call this one? Medical term. Your
Sa medical term. Kanang pusod. Sige na.
the navel.
Tinggalan?
Yes.
Spelling, sir.
Kanang N-A-V-E-L.
N-A-V.
Navel.
Basta yung emergency, look at the navel, using your ring finger at the finger, then place the heel of the palm.
Wala pa ko emergency, sir.
Wala pa may
Wash
emergency.
and rinse, and then include the navel. Then repeat if necessary, then change the water if necessary. Then after that, you have to pat dry. So what is the purpose of pat drying again?
Seal the moist.
So after that, chest and then abdomen, where we go from here? Proximal.
Proximal.
So distal arm, chest, abdomen, then proximal arm. So since pretty much we have to do whatever we did here as the proximal, distal, same as distal, proximal. Then you have to remove the receiving towel. Okay. So next.
Distal leg.
Yes, distal leg. Distal leg. Taas ng ba na eh? Completed Batman. Yes. So this time, we will be making a cuff. So kapag mo dili cuff drape, you have to drape the patient. Tanaw pag drape ninyo ha. Draping is this is used to provide privacy of the patient on the lower extremity. Naha. Ano yun? Ano, okay? Then slide. Diba? Then you have to place the receiving towel. Receiving towel and then your soaking basin. Yes, your soaking basin.
Grabe siya.
That's your soaking basin. And then include the bristle brush. Okay. So again, when brushing or when cleaning the lower extremity of your patient, the legs, you have to perform it in a long, firm stroke manner. Long, firm stroke manner. So wash and rinse. Ana ha? Yes. Then wash and rinse. Okay, then wash and rinse. Repeat if necessary. Then replace the water if necessary. Then you have to brush the nail. The interdigital, including the interdigital spaces. Then, if ever, you have to trim the nails. Then brush the foot of the patient. After that, remove. Then pat dry. So what is the purpose of drying? Ito ninyo inyong pana katong making a drape, you have to drape. That is to provide privacy of the lower extremity of your patient. So you
Drape.
won't be exposing the genital area. Okay, pat dry and remove. Remember ha, sa inyong materials, you have to return it wherever you get it. Okay, so kung di na nimo gikuha, or gikuha, di na rapod siya. Bahalag, basta ayaw lang gid ibutang lower than the, or pila ka inches, mga 6 inches from the floor. Ha? Yes. Dira, ang contaminator, kaya ayaw gid ibutang dire. Safe ra dire sa taas. Bahala na siya, basta dili lang gid pagka-interchange. Okay, now we will be, so what's next?
Proximal left.
Sige,
Proxima.
let's say, same naman na siya, same procedure as we, to the distal to proximal.
Back ano sir? Back
Okay,
correct.
good. Back.
Turn into sideline section.
Last na lang back.
Not yet.
Not yet?
Not
Oh
yet.
my God.
Aso na siya.
Side rail.
So, you have to place the patient in a similar sideline position. Abduct the near arm. Introduce the farthest leg. Then place the farthest arm near to the abdomen. Okay. Sorry.
Expose.
Then place the patient in a sideline position. Count of 3 by supporting the shoulder and the waist. On a count of 3, ma'am, I will be placing you in sideline position. 1, 2, 3. And then you have to provide privacy at all times. Okay. Then you have to prepare your receiving towel. Receiving towel.
Side up pa na sir.
No need.
Receiving, sir?
You should be-
Receiving?
Ha?
Receiving?
Receiving towel, yes. Or patting dry towel. Receiving towel na nato bisay. Receiving towel man good gamit ani. Then prepare your 2 basin for washing and rinsing. Washing and rinsing. Okay, make a meat. Purpose of your meat?
Kalimot ko ano mo. Give thanks, fluid.
Yes, prevents spillage of water, retains fluid, and induces warmth and comfort if applied. Induces warmth and comfort if applied. Then wash and rinse. Then, what is the principle in cleaning the back of your patient? So from cleanest to dirtiest, ha? So from upper back to lower back. You can
Circular
also
wash.
use the Center's Guide. Ano mo? Okay, then wash and rinse.
Pwede po circular motion.
Yes, wash and rinse. So from cleanest to dirtiest always. So wash and rinse, repeat if necessary, and then change the water if necessary. And then pat dry. So what is the purpose of pat drying?
To seal the moist.
So, okay. After that, if ever your patient will be asking or still upon the request of your patient, if she or he is going to ask for liniment, lotion, or powder. So this time we will be performing our 4 types of back rub. So first is we have Petersage, effleurage, tapotment, and the flexion stroke. So what is the first? Your Petersage. Your Petersage is Petersage. Pero siya, ako nga it is a circular motion. Then you have to perform at least, sorry. Parang siya, progression siya. Sorry. Starting at that, di ba, you have to, but what is the purpose of your back rub?
To circulate the ano sir.
Yes, promotes blood circulation and
Motion.
relaxation.
Relaxation.
Diba? So that is the purpose of your back rub. So in doing our back rub, should we start? Where are we going to start?
Inner to
Yes, from lower back to upper. Okay, from cleanest to dirtiest, tawing cleaning. So when doing your back rub, you have to start from lower back to upper back. So this is your Petersage. And then your yes. Diba? Yes. No. That is your effleurage. Effleurage. This is your effleurage. Sorry. This is your effleurage. Then your Petersage is like a pinching action. Okay. Yes. The next is your tapotment, which is the common, yes, rapid at, rapid striking of the body. So, that is what you call your tapotment. The next is your friction stroke. Either you can use your fingertip, your thumb, or your elbow. Then after that, you have to wipe off excess. After giving the back rub, you have to assist the wipe off excess lotion or liniment or powder. Then return the materials. Then place the patient back to supine position. On the count for dressing. On the count of 3. Mama,
Uy, baka ba? Kalimtin na si mga
Dalikan na niya siya.
Gutom naman po na siya gud. Gapil.
Then, when dressing your patient, probably is going to start. Let's say your affected part is on his left. Left is he's affected or with IV. Affected or unaffected? Yes,
Unaffected.
of course.
Huh?
With IV. Affected yapon kay imo man ang insert itong sleeve. You have to insert the sleeve.
Ah.
Yes.
Kanto na tong removing, sir. Mo to'y
Yes.
unaffected.
When undressing your patient, you have to start from unaffected to affected. When dressing, affected
Affected
to
to
unaffected. Libare yun.
Hospital kung anak na din.
Lagi. Then, sorry, I forgot.
Lahi na din.
You have to mention or you have to do this procedure before dressing your patient. You have to check the dress for any insects or loose threads.
Hala.
Okay. Then place the patient again in a sideline position. So you can tie the knots, the sling. So interlace abduct the arm, dress the farthest leg, and then place the farthest arm near the body, and then support the shoulder and the waist. And the count of 3, I'll be placing you inside the position, ma'am. 1, 2, 3. Then you have to tie.
From upper to lower. Kag mag-antay ka kay lower man.
Lower to upper.
man.
So upper string first, then lower. Because when we undress the patient, you have to untie from the waist string, di ba? Waist string to upper string. Next string. So, on the count of 3, place the patient back to supine position. 1, 2, 3. Then you have to make sure that the patient is comfortable and fix the gown properly. Okay na siya, no? Dili.
Comfortably na gud siya kana liguan.
Massage pa ito siya. Then you have to roll the top sheet back.
Walk in, walk first, then clean, matches.
And pull the back blanket underneath the top sheet. Then
Start to container, laundry container.
Then your closing spill, you have to remove discard your glove, remove discard your glove, then return the materials to proper location. Ensure the safety of your patient by checking and monitor the vital signs. Adjust the bed to possible waist position to prevent the patient from falling. And then, if the bed has no wheels, you can push the bed against the wall. The side dress up on both sides. Record what you have done and report any unusual condition to the supervisor. So, any question?
Sir, okay na sir.
Gutom na sir.
Very good. Thank you, sir.
Thank you.
So, tomorrow, paano na ta? Return day mo na ta?
Yes.
Yes.
Okay. Let's review ha. Okay, I'll be asking